I'm a psychiatrist. Yesterday we looked at Othello syndrome, a delusional disorder common in men, a delusion of jealousy. Today we're looking at erotomania, a delusional disorder that is common in women but also affects men. Erotomania is when a woman believes firmly that a person of high status is in love with her. And often it occurs in women who have very little experience with romantic relationships. So they may believe that the doctor they're seeing is in love with them. And when they go to the doctor's office, the way the doctor welcomes the woman, the way the doctor speaks to the woman, they pick those as clues, as messages that the doctor is telling them that the doctor is in love with them. And even when challenged that maybe the doctor is married, they would refuse that and say, no, the doctor is not married. He's just pretending to be married. So they live in a very different reality from everyone else. They might believe that a celebrity is in love with them. And when they're on TV and where they look, they take that as a clue that they're in love with them. And they get quite obsessed with this. For men, we're often likely to see the stalking. So a man may actually go to the woman's house, actually find the house and start stalking them. And this delusion can be classified into primary or secondary. So primary is when there is no associated mental illness. It's just a delusion where a woman believes that somebody of very high status, somebody who is unattainable to them, somebody who's way out of their league is in love with them. And the second one is when it's associated with a mental illness such as bipolar or schizophrenia. There are treatments for these delusional disorders. And when you find that a person you know, or you hear a story, somebody explaining that this person has an unreasonable belief that somebody of high status is in love with them, and even when you try to talk to them, you're unable to make them see the truth that is contrary to what they believe in, then you can ask them to see a psychiatrist. Antipsychotics can help with treating this delusion. If not, supportive therapy can help. If not, then shock therapy can also be helpful.